Good afternoon. My name is Victor Maldonado, Communications Manager for the AIDS Education and Training Center's National Center for HIV Care in Minority Communities, otherwise known as the AETC-NCHC-MC. Welcome to today's conference, the second in a series of 5 calls to take and answer questions from health centers on the capacity building opportunity being offered by the AETC. As a reminder to all of our participants, today's call is being recorded. With that, I would like to introduce our first presenter, Javier Salazar, Project Director for the AETC-NCHC-MC. Javier.
Thanks, Victor. Hi, everyone. My name is Javier Salazar, and I'm the Senior Director of Programs at Health HIV, as well as being the Project Director for the AETC-NCHC-MC. I'd like to welcome you and to thank you for your interest in the AETC. The purpose of our call today is to offer health centers around the country the opportunity to gain further information on and inquire about our current capacity building opportunity, as we call it, the HIV and Primary Care Learning Community, and in this case, the 2012 HIV and Primary Care Learning Community. In addition to Victor, I'm joined today by our program manager, Christine Stewart. So to begin our call, I'd like to review the agenda. Our agenda today includes an overview of several topics that are related to our project and the application selection process. We will provide an overview of the AETC. We'll provide an overview of the learning community. We'll discuss the health center selection process, the application process, and then finally, we'll leave some time at the end for you to ask your questions. About the AETC. The AETC represents the Health Resources and Services Administration's HIV/AIDS Bureau's major effort to reach beyond its grantees, the Ryan White funded community, and to address the evolving needs and nature of HIV care and treatment within highly impacted communities of color. It's funded through the Minority AIDS Initiative and the AIDS Education and Training Center program. It is specifically focused on expanding the organizational capacity of federally qualified health centers and lookalikes to provide care and treatment to people living with HIV. And it supports the President's National HIV/AIDS strategy in reducing HIV-related health disparities by expanding HIV care and treatment capacity at the community level and facilitating linkages to support sustainability. It provides comprehensive organizational capacity building in addition to clinical training on HIV care and treatment. Selected health centers will undergo an intensive practice redesign to develop, expand, or improve organization-wide systems, practice processes, and outcomes to build sustainable HIV programs. About the HIV primary care learning community. A learning community is an established model that brings together multiple stakeholders around a common purpose and provides training, capacity building, and coaching while also sharing knowledge across organizations. By facilitating shared knowledge across the organizations, the learning community generates new ideas and innovations, improves measurement of common health status indicators, and ultimately works to ensure the delivery of quality HIV care. And the purpose of the HIV and primary care learning community is to increase access to comprehensive HIV primary care for racial and ethnic minority communities severely affected by HIV by developing the organizational capacity of health centers not directly funded through the Ryan White program. This diagram visually depicts the learning community curriculum, which is designed around the patient-centered medical home model and practice redesign. We won't go into too much detail here, but we want to show you that it's built to support the integration of HIV into primary care practices, while also providing clinical support for the expansion of HIV care and treatment. If your health center is selected, we will present the curriculum in detail to you as a group. The capacity building package offered to each health center will include TA in a variety of areas, including HIV clinical care within primary care, patient-centered medical home with HIV as a population of focus, care coordination, partnership development, practice and system redesign, maximizing revenue for HIV services, and building the business case. The curriculum will be delivered through self-paced learning, tailored on-site technical assistance, as well as utilizing distance technologies. We will offer health centers a few resources in addition to supplement the capacity building. These include clinical mentors to support clinical learning, performance improvement coaches to provide guidance during the transformation process, twinning with Ryan-wide Part C clinics in their region to increase sustainability of clinical TA offered through the center and through its sister regional AETCs. To support health centers in the learning community over time, we've created the Virtual Learning Lab. This slide is a screen capture of the lab, which is a restricted access web-based portal that provides a safe space for staff of health centers to engage in shared learning. It includes discussion boards, live and archived webcasts, and discussions facilitated by our clinical and program faculty, and a resource library.
Thank you, Javier, for that overview. Our next presenter, Christine Stewart, Program Manager for the AETC NC will describe some other features of the application process. Christine.
Thank you, Victor. I'd actually first like to start by discussing some benefits of participation. So the expansion of access to healthcare services beginning in 2013 could mean an increase in patients for health centers, including those living with HIV. So participation in this program can help your organization be proactive and prepared to provide care and treatment to people living with HIV. You can also help thoughtfully expand services in a sustainable manner, learn how to maximize revenue to cover costs for the addition of HIV services, and connect to state and local networks to help support your new HIV services. We realize these changes cannot be implemented successfully solely by transferring knowledge to the clinical staff. We believe that for change to be successful, we must enact changes throughout the entire organization. As Bob mentioned earlier, we do this through practice redesign based on the patient-centered medical home framework. Federal regulations will require CHCs to become recognized medical homes in the next few years, so this project aligns with transformation activities your organization may currently be involved in or may soon engage in. While HIV is the population of focus in this project, the assistance you gain is broadly applicable and supports the entire organization. All of this will be supported by access to expert faculty, many live and archived webinars, and face-to-face workshops and targeted technical assistance. And all of these services are free and at no cost to your organization. And even if your organization is not selected for participation in the learning community, Health HIV can connect you to other capacity building opportunities that we're involved in to improve your HIV services. Each organization selected for the 2012 cohort should prepare for a one-year time commitment and commit to develop or expand HIV services. We expect participation to be supported by and involve the CEO from each organization. The CEO's role is mainly to remove barriers for staff that are implementing the change and allow time to access learning resources and have a willingness to restructure organizational systems. Each organization will also be asked to appoint 2 learning leaders, one that will lead the practice transformation, and the other to coordinate the learning needs of the clinical staff involved in this project. These leaders should be senior staff that have the power to enact change within your organization. These learning leaders will be our main contacts for the project. We will ask participating health centers to complete an organizational assessment as well as individual clinical assessments for providers participating in the project. We will also ask that organizations participate in site visits if necessary, where members of the learning community team come on site to your health center to meet with your learning leaders, the CEO, and other key staff involved in the project. We expect regular communication with ACC, NCHC, MC staff, and our performance improvement coaches, and this communication involves reporting as well. And lastly, we want to point out that we expect the change to be supported organization-wide and not solely through one department or unit, like the HIV department. To be eligible for participation in HIV in primary care learning community, organizations must be federally qualified health centers or health center lookalikes that are not directly funded by the Ryan Way HIV program and have a 4-year history of providing primary medical care within racial and ethnic minority communities. In the past, we've received questions around receipt of Ryan Way dollars, and we'd like to stress that subcontractors are eligible. Just as long as the health center is not the direct HIV/AIDS Bureau grantee, they are eligible for this project. And if you have further questions about that, feel free to contact me after this. Through our experience, we've also identified characteristics that may demonstrate that a health center is prepared to succeed in the HIV and primary care learning community. Even if you don't meet some of these characteristics, we still encourage you to apply. Again, this is just from our experience. We noticed that organizations that have a demonstrated commitment and intent to deliver HIV care and treatment services have been successful. Those that have senior leadership in place for at least 3 years, the capacity to manage HIV patients, and the ability to report outcomes through EHRs or practice management systems also have an easier time, and those organizations that have dedicated quality improvement staff persons. Participating health centers should also be located in or near a community whose residents are at risk for or living with HIV and are predominantly racial and ethnic minorities. Preference will be given to organizations located in a geographic area with a high burden of HIV disease with relatively low resources. Additionally, the HIV/AIDS Bureau, the funder of this program, has requested that the center give particular emphasis to recruiting health centers in the 12 high-burden areas identified by the CDC, which are on this slide here. While we are charged with focusing on the 12 cities shown on the previous slide, we are recruiting organizations across the entire United States and U.S. territories. We're interested in health centers that reach vulnerable populations like migrant workers, the homeless, transgendered individuals, and youth as part of this project. If you have additional questions about eligibility, please visit our project website, www.nchcmc.org. Now for the application. Interested health centers will need to complete an application that explores capacity and infrastructure to provide HIV care. The application is currently available in 2 formats, a web-based version and a Word document fill-in form. We request that the Word form be returned in Word format by email, but fax is also acceptable if you are unable to email the completed application. The application will also be available in Spanish for those that need it on our project website next week. Again, the application can be accessed by visiting our project website, www.nchcmc.org. We've tried to make the application simple to complete, but we'd like to share a few notes about filling out the application. You'll need to use your 2010 UDS data for Section 1, and questions requiring a narrative response are limited to 75 words in the response field unless otherwise noted, so please keep that in mind when crafting your response. You'll also need a signed letter of support from your board chair, and that's required to complete your application package. If we don't receive that, we will contact you and request that before we can consider the package complete. So each application will be reviewed by an external review panel representing both primary care and HIV expertise and experience. The review panel will score each application and make recommendations for selection of up to 25 health centers. Health centers selected will be notified by the beginning of the new year. And I'd like to go over some key dates. So again, the application is due November 18th. As I've just mentioned, the health centers selected will be notified by January 1st, 2012. We will immediately begin assessments of each organization, and we'll contact you to schedule those, the points of contact listed in the application. We'll be pulling together each health center for the 2012 cohort in what we're calling a community meeting. It's a face-to-face meeting that will occur in Washington, D.C. in spring 2012. And the project will continue through December 2012, and we will support each organization in the 2012 cohort through the end of our project, which is in August 2013.
Thank you, Christine. At this time, we will unmute all phone lines for questions, but request that if you would like to ask a question of the presenters, either click the raise hand button so we may call on you, or the chat button and type your question to the presenters. Due to the unusually high number of callers on this call, we ask that you mute your line unless you intend to ask a question. Chat questions will be read aloud to all participants and answered for all to hear. If you do raise your hand and have been called on, please lower your hand by clicking on the icon a second time. All lines have been unmuted. And we have a question coming in from Kim. Kim asks, any idea on the possible number of health centers that will be selected outside of the 12 focus cities? Javier?
Thanks, Kim. This is Javier. We will be selecting up to 30 health centers this year, and that we don't have a set ratio of the number of health centers that we will be selected within the target cities and outside of those. We do, however, want to make sure that there is diversity in health centers, there's diversity in populations that are being addressed, there's geographic diversity, and there's diversity including in some of the subpopulations, for example, women, homeless, migrant health centers, et cetera. So I hope that answers your question. And so we encourage, although we've been asked to prioritize those 12 cities, we are very interested in selecting those outside as well.
And so if any of these health centers that are on the call today are located in a rural area and not located near one of those 12 cities, we do still encourage you to apply. We have a number of organizations in our current cohort that are in rural areas, and as Javier mentioned, we do want to make sure that we have geographic diversity as well.
And just to piggyback on what the two have already said, Health HIV can also connect interested health centers with other capacity building opportunities we're involved in. So we do encourage any interested health center to submit an application for this process so that we can be aware of their desire to integrate HIV into primary care. We have another question coming in from Jim. Jim asks, what is the time commitment expected of CEOs? Christine?
Sure, Jim. The CEOs, we expect the CEOs to be involved in the beginnings. They'll be the ones that are determining the learning leaders that will be our main points of contact for the project throughout the year. And the CEO, as I mentioned earlier, will also be involved more in the background, but they're the ones removing any barriers and making the work of the learning leaders and those participating in the project easier. We will periodically request that they be involved in conference calls to check on the progress of the health center within the project. But we do understand that CEOs are busy, so we will limit the pull on the time. But we expect that will be about 1 hour a month. The one definite time requirement that we will have at the beginning of the meeting, the cohort, was during that community meeting. We expect that the CEO will attend, as well as the 2 learning leaders that person designates. And again, that's in spring 2012 in Washington, D.C.
Thank you, Jim. I hope that answers your question. A quick reminder to all our participants, if you are not asking a question, we ask that you please mute your phone to block out any background noise. Thank you. And we have a question from Cliff. Cliff asks, is there a minimum number of HIV patients expected to participate in this program?
And this is Christine Stewart, one of the program managers here on the ATC. And to answer your question, Cliff, no, there is not a minimum number of HIV patients that we expect our health centers to have. This project is about building and expanding your capacity to treat people with HIV, and many of our organizations do not currently have HIV patients, but we hope that with the services that you receive through this project, you can begin to see any that you might have had within your health center that maybe you start referring out and be able to see them within your health center at home, their medical home.
I hope that answers your question, Cliff. And I'd like to call on Jennifer. Jennifer, your line is unmuted if you'd like to ask your question.
Hi, this is Jenny Clark, and I was wondering, are they willing to work with health centers that don't have experience in the HIV population? We're just now starting a free screening program, and we'd like to move that into a more comprehensive program.
The answer to that is yes. What we have found is, you know, if the health center has initially developed has the foundation of at least a testing program, it makes it easier to move forward. But it sounds like you've got an initial screening program. We are interested in working with and identifying the health centers that want to build their capacity. So that can absolutely happen.
Thank you, Jennifer, for your question. I hope we've been able to answer it.
Yes, thank you.
Thank you very much. A quick reminder to all our callers, if you do raise your hand with a question and you have been called on, please click on the raise hand icon a second time so that your hand is removed from the queue. While we wait on other callers to present questions, I'd like to take a moment to remind you that due to the high level of interest demonstrated by health centers in this capacity building opportunity, we will be hosting 3 more conference calls over the next week. Conference calls are scheduled for Friday the 21st, this afternoon, at 3 p.m. Eastern, as well as Tuesday the 25th at 1 p.m. Eastern, and Wednesday the 26th at 4 p.m. Eastern. We encourage you to invite other members of your staff, as well as let your colleagues, both within your health center and outside your health center, know about this opportunity should they have any questions. And we have a question coming in from Carol. Carol asks, is financial information, in other words, budget, required to apply to this program? Christine?
Simple question. The simple answer is no, it is not.
We don't ask for any financial or budgetary information.
Well, thank you, Carol. Easy question, easy answer. We have a question from Jennifer. Jennifer asks, does this program provide any funding to the health center?
Take that.
Javier?
Health centers that are selected to participate in this program will receive a limited financial assistance. For example, in the past we have offered stipends to participate in particular meetings, or if there are particular conferences that would be beneficial, for example, for the clinical staff to participate in, we would support that. We also have travel, training, mentoring, and TA, and all these costs are covered for the duration of the program. In addition, we also have all the expert faculty, the opportunities, the TA, and the related support will be made available. for example, to improve billing systems and revenue capture as a way to supporting, the focus on trying to secure additional resources.
Thank you so much, Jennifer. And we'll pause one more moment for any other questions. Lines are unmuted.
Again, if you have a question, please click on the raise hand button.
You have a question from Jill. What phone number can a project officer be reached at if there are future questions? Well, Jill, you read our minds, and here is the contact information for our program officers. Both Christine and Brad are available should you have any questions. And Jill, you have stolen my thunder to close this out, but I'll try anyway. Thank you all for participating on today's web conference. If you have questions about this opportunity or know of someone in your health center who would be interested in learning more about this program, please contact Brad or Christine. Their information is listed here for your convenience. Thank you all for your questions and for your time. We encourage you to visit the NCHCMC website to visit our frequently asked questions page, as well as our application page to download the application or fill it out online. At the end of this presentation, there is a brief survey. We ask that you just take a moment or two to complete it to let us know if this has been informative to you and how we may improve future calls. And we have one last question coming in from Jolene. Jolene asks, since the focus is on increasing F2HC participation, and yet there has been a targeted group, 12 urban cities defined, what is the plan to nationally increase HIV education, screening, and or treatment?
And again, I'd just like to point out that our funder has just asked us to focus on those 12 cities, but we're not limited to those 12 cities. We are still a national, our project is still nationally focused, and again, we recruit and want organizations from all corners of the United States, including the territories, so that includes rural areas, suburban areas. So again, we're not limited to the 12 cities. Again, we're just making sure that we have a presence in those cities.
And Jolene, if you have any specific questions, we're here to answer them. You can reach out to Christine or Brad or myself.
To anyone who joined this conference call late or would like to review any of the material presented on this call, a recording will be made available to you on the NCHCMC website. Before we go, Bisha asks, will these slides be available to participants? Well, Bisha, I hope you take my advice and visit the NCHCMC website where this presentation will be made available. Thank you all again for your time, and have a pleasant afternoon.